How's it going, everyone? So today I'm going to talk about hernia surgery and what you can expect from it. So before I begin though, please subscribe to my channel if you guys haven't already. I do appreciate the support. It helps my channel grow. Also, if you're interested in online personal training from me or buying some cool fitness products from Amazon, have a look at my description box. So let's get started. What can you expect from your surgery recovery time from a hernia? Well, the recovery time is going to be dependent on what kind of surgery you have. So it all depends. So if your abdomen wall is reconstructed, you may have to stay in hospital for a few days. If you have just a minor surgery, then you may only have to stay in for maybe like a couple hours afterwards. So it all depends on what kind of surgery you actually have. So where can you get hernias? You can have inguinal or you can have groin hernias, you guys. You can have ventral hernias, you can have femoral hernias, you can have incisional hernias, umbilical hernias, epigastric hernias. You can have totally different amount of hernias. So it all is going to be dependent on what kind of surgery you actually have. So what are the types of hernia surgery? You have minimally invasive hernia repair. So that's basically when a surgeon uses a laparoscope to fix the hernia. Then you have open hernia repair. A surgeon will make a small incision in the patient's abdomen and he pushes the bulging tissue back to where it belongs. So it all depends. Like, to be honest, I wouldn't really worry too much about the equipment that they're using, if it's open or if it's minimally invasive. That's in my opinion. I really wouldn't worry too much about it. I also wouldn't worry too much if you have to spend a day or two in the hospital. I know it's super crazy. For me personally, you guys, I had my tonsils out and I had to stay in the surgery 3 hours after. What happened after that, after the week, was that they botched the surgery. It wasn't done correctly. There was a 1% chance of it happening. And then actually on Christmas Eve at 11:30 at night, I started hemorrhaging. And then at 5 o'clock in the morning on Christmas Day, you guys, I'd have emergency surgery to fix my tonsils. So I know what it's like to have surgery. I was spitting out blood, puking out blood. It was very disgusting, extremely scary. I had to get rushed by ambulance. It was very bad. I know what you guys are going through. Try not to be scared or anything like that. If you guys need to talk to someone, comment on my YouTube channel. I always respond to all my comments. So do not be scared, you guys. I am here to help you guys. So most patients, you guys, usually require a 2-week follow-up to make sure that everything is okay and there is no infection. That's for most surgeries. Even for my tonsil surgery, that's how it went. It was a week later, and then 2 weeks later I had to go for a follow-up. So same is going to be required for you guys' hernia surgeries. You're going to have usually a 2-week follow-up in most cases, just to make sure everything is okay, there are no infections, anything like that. You will not be able to lift anything probably heavier than 10 pounds for at least the next 2 weeks. That was the same for my tonsil surgery too. Couldn't lift anything heavy for 2 weeks. It's going to be the same for the hernia, because in most cases the hernia was caused by lifting something up. That's how most hernias are caused, you guys. So just understand you won't be able to lift anything heavy up. So if you guys are going to a day job that requires you to lift heavy things up, I would highly recommend giving them advancement, telling them a month, 2 months advance that you will be having this surgery. Or if you have to have the surgery, then just tell them as soon as possible. I mean, if you have to have it, you have to have it. There's not much that you can do, but try to do your best. Be a good employee and try to let them know that you need to have it. Pain and fatigue will be present up to 2 weeks. I cannot comment on the hernia pain, but I can tell you for the tonsil pain, it was an absolute nightmare. It was the worst pain of my life. Again, that's because the surgery was botched. In most cases, a tonsil surgery, the pain isn't too bad. For mine, it was freaking excruciating. And even the doctor said, because of what happened, your pain was excruciating, and it was, you guys. I'm pretty tough. I can work out. I can do all this. The pain was there. It was very tough. And I was on a ton of medication. I was on a crap ton. Again, the reason why I'm talking about my surgery, the hernia surgery, just so I can kind of relate to you guys, kind of tell you guys what I went through, just the surgery side of it, because that's why you guys are here. You guys are kind of a little bit nervous about the surgery. Your mind's going to tell you more things than you want it to know. The surgery is going to go fine. I know you guys are going to do really well. I believe in you guys, so have no worries. But yeah, pain and fatigue will be present up to 2 weeks. There will be some medications commonly taken for the pain, the discomfort following the surgery. Another thing too is They have said for hernia surgery, you can get constipated because of the medication. I was constipated from my medication for my tonsil surgery, you guys. So what you can do is take a mild laxative, stuff like that, but just make sure you talk about it with your doctor and when it is okay to do that. Make sure you always talk to your doctors about these things. Some people can go back to work within 3 to 7 days. For me, it took 2.5 weeks just because I waited a week. I was supposed to go back the next week, but again, I had the emergency surgery. I was actually off for 3 weeks. But chances are everything will go good for you guys. Do not worry. Trust me on this. No matter what happens, trust me, everything will go good. So end the video, hopefully I gave you guys some signs, some symptoms, ways that you guys can fix it. And the biggest thing is just do not stress. If you guys are feeling stressed, comment below. I will answer all your questions. So thank you guys for watching. Again, please subscribe to my channel if you haven't already. Like the video. Have a look at my description box if you guys are interested in anything fitness, workout related. Thanks for watching.